Welcome to the Diverse Vascular Cognitive Impairment and Dementia Study. This important nationwide research study focuses on how our blood circulatory systems affect our brain health. Now, by study in, we will understand how our heart and brain health are linked. With this new knowledge, we will be able to detect and diagnose vascular cognitive impairment, helping millions of Americans live longer and healthier. Here are some of the types of things you can expect to be asked to do when you join this study.
Okay, I told Mrs. Turpin now. Thank you so much for coming in.
Upon arrival at your research center, you will be greeted by a patient navigator who will ask you some questions. Together, you will fill out paperwork to consent to be in this study.
I will need your initials and your name in here for you to participate in our study.
This consent acknowledges what the study information is used for and confirms that participants, like you, are willing to come to 3 clinical visits over a 3-year period. These clinical visits consist of some pencil and paper tests, blood sampling, an MRI, and a clinical exam by a medical doctor.
But today I wanted to ask you some questions about your health background and also how you feel your memory is doing.
This exam is like your annual doctor visit, but includes a few more tests to better understand your heart and brain health. This doctor's appointment will also include balance and reflex tests.
Well done.
How are you doing today?
Another visit will be an MRI, or magnetic resonance imaging scan. An MRI gives us detailed images of your brain and is one of our most valuable scientific tools. It is a painless way to look inside your body and get images without radiation.
Today I'll be asking you a few memory questions. So some may be easy, some will be hard. Just try your best, okay?
The paper and pencil tests ask you to respond to a wide range of questions that test your mental functioning, mood, and behavior. These tests usually involve writing and drawing, solving puzzles, or responding quickly when presented with a choice. It is important to do your best on all of the tests for your results to be most informative.
All right, now if I could have you roll up your sleeve for me.
Finally, we will take a few tubes of blood from a vein in your arm and send it to a laboratory for analysis. This procedure is just like the one you may have done before at your family doctor's office. From your blood, we will understand how inflammation and circulatory health are related to brain disease and memory impairment. Your participation in this important study will help us understand more about how lifestyle and life challenges affect the brain health of people from diverse communities. Our goal is to be able to develop tools for medical doctors to diagnose and treat cerebrovascular disease before it causes cognitive decline or leads to dementia. Please join us on this important journey to discovery.